Welcome to this channel, where we provide educational content on medicine, pharmacy, and health to empower your learning and practice. Today, we're diving into another exciting topic in our pharmacology quiz series, Sympathomimetics. This quiz will test your knowledge and reinforce your understanding of this essential pharmacological topic. Make sure to check out the companion video on this channel, which provides an overview of the main concepts of sympathomimetics. The link to that video is available in the description below. Quiz instructions. This quiz will cover 10 multiple-choice questions, MCQs, focused on sympathomimetics. Each question includes 5 options, of which only one is correct. After each question, we'll reveal the correct answer, provide an explanation for why it's correct, and explain why the other options are incorrect. So, let's get started. Question 1. Which of the following is a non-selective beta-adrenergic agonist used primarily in the treatment of bradycardia? Option A, dobutamine. Option B, albuterol. Option C, isoproterenol. Option D, phenylephrine. Option E, salmeterol. The correct answer is option C, isoproterenol. The explanation is as follows. Isoproterenol is a non-selective beta-adrenergic agonist that activates both beta-1 and beta-2 receptors, making it effective in increasing heart rate and cardiac output, particularly in bradycardia. Its ability to reduce vascular resistance via beta-2 receptor activation further supports its therapeutic use. Here is why other options are incorrect. Option A is incorrect because dobutamine is a beta-1 selective agonist and does not significantly activate beta-2 receptors. Option B is incorrect because albuterol is a selective beta-2 agonist, primarily used for bronchodilation in conditions like asthma. Option D is incorrect because phenylephrine is a selective alpha-1 agonist, which causes vasoconstriction but does not affect beta receptors. Option E is incorrect because salmeterol is a long-acting beta-2 agonist used for asthma and chronic obstructive pulmonary disease. Question 2. A patient presents with acute anaphylaxis in the emergency department. Which of the following sympathomimetic drugs is the first-line treatment? Option A, epinephrine. Option B, phenylephrine. Option C, norepinephrine. Option D, dopamine. Option E, clonidine. The correct answer is option A, epinephrine. The explanation is as follows. Epinephrine is the drug of choice in anaphylaxis due to its potent alpha-1, beta-1, and beta-2 agonist activity. It counteracts hypotension, relieves bronchoconstriction, and reduces edema through vasoconstriction. Here is why other options are incorrect. Option B is incorrect because phenylephrine lacks beta receptor activity, making it ineffective in treating bronchoconstriction. Option C is incorrect because norepinephrine is primarily an alpha-1 agonist with limited beta-2 activity, so it cannot relieve bronchoconstriction effectively. Option D is incorrect because dopamine has a limited role in acute allergic reactions. Option E is incorrect because clonidine is an alpha-2 agonist used to lower blood pressure, not for managing anaphylaxis. Question 3. Which of the following sympathomimetic agents is selective for beta-2 receptors and is commonly used to manage asthma symptoms? Option A, terbutaline. Option B, norepinephrine. Option C, dobutamine. Option D, clonidine. Option E, phenylephrine. The correct answer is option A, terbutaline. The explanation is as follows. Terbutaline is a beta-2 selective agonist that relaxes bronchial smooth muscle, making it an effective medication for relieving acute bronchospasm in asthma. Its selective action minimizes cardiovascular side effects compared to non-selective agonists. Here is the explanation for the incorrect options. Option B, norepinephrine is incorrect because it primarily acts on alpha-1 and beta-1 receptors and lacks significant beta-2 selectivity. Option C, dobutamine is incorrect because it is a beta-1 agonist used in heart failure, not asthma. Option D, clonidine is incorrect because it is an alpha-2 agonist and does not target beta-2 receptors. Option E, phenylephrine is incorrect because it is an alpha-1 agonist and does not cause bronchodilation. Question 4. A selective alpha-1 adrenergic receptor agonist is likely to have which primary therapeutic effect? Option A, bronchodilation. Option B, vasoconstriction. Option C, increased heart rate. Option D, sedation. Option E, skeletal muscle relaxation. The correct answer is option B, vasoconstriction. The explanation is as follows. Alpha-1 adrenergic receptor agonists primarily induce vasoconstriction, which is useful in conditions like hypotension or nasal congestion. By tightening vascular smooth muscle, these drugs increase blood pressure and reduce nasal swelling. Here is the explanation for the incorrect options. Option A, bronchodilation is incorrect because it is mediated by beta-2 receptors, not alpha-1 receptors. Option C, increased heart rate is incorrect because alpha-1 stimulation does not directly affect heart rate, beta-1 receptors mediate this action. Option D, sedation is incorrect because alpha-1 agonists do not have central nervous system depressant effects. Option E, skeletal muscle relaxation is incorrect because this effect is mediated by other pathways, not alpha-1 receptor activation. Question 5. Which of the following drugs acts as an indirect sympathomimetic by increasing the release of norepinephrine from presynaptic terminals? Option A, amphetamine. Option B, dobutamine. Option C, isoproterenol. Option D, albuterol. Option E, epinephrine. The correct answer is option A, amphetamine. The explanation is as follows. Amphetamine increases the release of norepinephrine and dopamine from presynaptic neurons, enhancing adrenergic signaling. This indirect action underlies its use in disorders like ADHD and narcolepsy and contributes to its stimulant effects. Here is the explanation for the incorrect options. Option B, dobutamine is incorrect because it directly stimulates beta-1 receptors without increasing norepinephrine release. Option C, isoproterenol is incorrect because it is a direct non-selective beta agonist and does not act indirectly. Option D, albuterol is incorrect because it is a beta-2 selective agonist and does not increase norepinephrine release. Option E, epinephrine is incorrect because it is a direct-acting sympathomimetic and does not indirectly release norepinephrine. Question 6. Which of the following is a contraindication for the use of beta-2 agonists in managing preterm labor? Option A, cardiac arrhythmia. Option B, bronchospasm. Option C, hypertension. Option D, hypokalemia. Option E, pulmonary edema. The correct answer is option E, pulmonary edema. The explanation is as follows. Pulmonary edema is a known contraindication for the use of beta-2 agonists in preterm labor because these agents can cause fluid retention and exacerbate pulmonary congestion. This is due to their cardiovascular effects, such as increased heart rate and systemic vasodilation. Here is the explanation for incorrect options. Option A is incorrect because cardiac arrhythmia is a potential adverse effect but not an absolute contraindication. Option B is incorrect because bronchospasm is managed by beta-2 agonists, not contraindicated. Option C is incorrect because hypertension is not typically worsened by beta-2 agonists. Option D is incorrect because beta-2 agonists can cause hypokalemia, but it is not a contraindication. Question 7. Which of the following drugs is a mixed-acting sympathomimetic that activates adrenergic receptors directly and promotes norepinephrine release indirectly? Option A, pseudoephedrine. Option B, phenylephrine. Option C, epinephrine. Option D, salbutamol. Option E, clonidine. The correct answer is option A, pseudoephedrine. The explanation is as follows. Pseudoephedrine is a mixed-acting sympathomimetic that stimulates adrenergic receptors directly and also increases norepinephrine release from presynaptic terminals. This dual mechanism makes it effective in conditions like nasal congestion. Here is the explanation for incorrect options. Option B is incorrect because phenylephrine is a direct-acting alpha-adrenergic agonist. Option C is incorrect because epinephrine is a direct-acting sympathomimetic without significant indirect activity. Option D is incorrect because salbutamol is a selective beta-2 agonist, not mixed-acting. Option E is incorrect because clonidine is a selective alpha-2 agonist, not mixed-acting. Question 8. Which of the following agents is a selective alpha-2 agonist commonly used in managing hypertension? Option A, clonidine. Option B, dobutamine. Option C, epinephrine. Option D, albuterol. Option E, isoproterenol. The correct answer is option A, clonidine. The explanation is as follows. Clonidine is a selective alpha-2 agonist that decreases sympathetic outflow from the central nervous system, effectively lowering blood pressure. Its use is particularly valuable in managing resistant hypertension. Here is the explanation for incorrect options. Option B is incorrect because dobutamine is a beta-1 agonist primarily used for cardiac support. Option C is incorrect because epinephrine is a non-selective adrenergic agonist with no specific role in hypertension. Option D is incorrect because albuterol is a beta-2 agonist used for bronchospasm. Option E is incorrect because isoproterenol is a non-selective beta agonist, not an alpha-2 agonist. Question 9. A 35-year-old woman with a history of asthma and hyperthyroidism presents with palpitations after using her inhaler. Which sympathomimetic is most likely responsible for her symptoms? Option A, salmeterol. Option B, albuterol. Option C, dobutamine. Option D, phenylephrine. Option E, terbutaline. The correct answer is option B, albuterol. The explanation is as follows. Albuterol, a beta-2 agonist, is commonly used in asthma management but can cause systemic beta-adrenergic stimulation, leading to palpitations, especially in sensitive patients such as those with hyperthyroidism. Here is the explanation for incorrect options. Option A is incorrect because salmeterol is a long-acting beta-2 agonist, less likely to cause immediate palpitations. Option C is incorrect because dobutamine is a beta-1 agonist primarily used for cardiac support. Option D is incorrect because phenylephrine is an alpha agonist, not associated with these symptoms. Option E is incorrect because terbutaline, though a beta-2 agonist, is not the primary culprit here due to its less frequent inhaler use. Question 10. A 45-year-old male patient presents with nasal congestion and hypertension. Which sympathomimetic drug should be avoided in his treatment? Option A, albuterol. Option B, pseudoephedrine. Option C, phenylephrine. Option D, salmeterol. Option E, dobutamine. The correct answer is option B, pseudoephedrine. The explanation is as follows. Pseudoephedrine is contraindicated in patients with hypertension due to its alpha-adrenergic agonist activity, which can cause vasoconstriction and elevate blood pressure further. Here is the explanation for incorrect options. Option A is incorrect because albuterol is a beta-2 agonist and does not affect blood pressure significantly. Option C is incorrect because phenylephrine, while a vasoconstrictor, is less commonly associated with systemic hypertension. Option D is incorrect because salmeterol is a long-acting beta-2 agonist used for respiratory conditions. Option E is incorrect because dobutamine is a beta-1 agonist, not used for nasal congestion. Conclusion. That wraps up our revision on sympathomimetics. I hope you found this quiz session engaging and informative. To deepen your knowledge further, consider reading resources like Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, BNF. These references will solidify your understanding and enhance your preparation. Thanks for watching. If you found this video helpful, don't forget to give it a thumbs up and share it with others. Subscribe to this channel and hit the notification bell so you never miss an update in the series that we are doing. For more learning resources, check the description below. See you in the next video.